My name is Sarah Wilson. I'm the Nutrition Manager at Gleaners Food Bank of Indiana. And today I want to give you an overview of our nutrition policy, why we implemented it, what its components are, and what this policy means for our food bank and for the community that we serve. So let's get started. So let's start by talking about why a food bank such as Gleaners would implement a nutrition policy. Well, let's look at the purpose of a nutrition policy. The purpose really is to serve as an official set of guidelines to maximize the nutritional value of the foods that we're procuring and distributing. It serves as a guide for consistent decision-making among staff members about the foods we acquire and distribute. And it can increase the availability of a variety of health-promoting, culturally inclusive foods that align with the healthy eating research guidelines, which was a new set of standards passed in 2020 that has been infiltrating the charitable food system since and has become a standard for measuring the nutritional quality of foods. A nutrition policy can also communicate a food bank's commitment to nutrition and health to the community that it serves. It serves as an official document to help explain and describe why we value nutrition and how we plan to implement more nutritious foods into our food bank inventory. This policy can also serve as a model for agency partners such as food pantries, soup kitchens, or other community centers to be able to assess the nutritional quality and cultural inclusions of the foods that they supply to their community. And most importantly, a nutrition policy is designed to positively impact the health and well-being of the neighbors that we serve. This is the ultimate goal and purpose, and exactly why Gleaners chose to implement a nutrition policy, which was passed in February of 2022. So let's watch a short video from Feeding America to get a little more background on how nutrition can be impacted by food insecurity and why this work is just so important.
What if you had to make the choice between meals and medicine? Between making rent and filling lunch boxes? What if you didn't have enough money to keep the power on at home and nourish a healthy body? 37 million Americans, that's 1 in 9, are food insecure. This means they lack consistent access to enough nutritious food for an active, healthy life. Our neighbors who are food insecure cannot always stretch their household budgets to meet their basic needs. Even with the support of federal nutrition programs or help from family, friends, and community organizations, food insecurity can have serious long-term effects on a person's health. Healthy bodies and minds at every age require nutritious meals. When people don't have enough food, when they consistently need to choose inexpensive, low-quality calories, or experience chronic stress about where they will get their next meal, their health can suffer. People who experience food insecurity are at higher risk for diet-related diseases, such as type 2 diabetes, high blood pressure, heart disease, and obesity. More than half of households served by the Feeding America nationwide network of food banks have at least one member with high blood pressure. 1/3 have at least one member with diabetes. When an individual or family cannot afford enough nutritious food, they sometimes adopt coping strategies and trade-offs that work in the short term to avoid hunger. However, over time, these can increase the risk for diet-related disease and make it more challenging to manage. This reality can lead to a cycle of poor health. The cycle begins when an individual or family cannot afford enough nutritious food. The combination of financial stress and inadequate nutrition can result in poor disease management. The time and money needed to respond to these worsening health crises further drains the household budget, leaving little money for essential nutrition and medical care. This causes the cycle to continue. Food insecurity also negatively impacts the lives of future generations. In the United States today, more than 11 million children lack regular access to nutritious food. children at risk of hunger are more likely to be in poor health and struggle in school. For some, it may have negative lifelong implications that could prevent a developing child from reaching their full potential. Together, we can make real change. We can break the cycle and build healthy, strong communities. Join the Feeding America nationwide network of food banks as we work to ensure all Americans have access to the nutritious foods we need to thrive. Take action. Advocate, volunteer, donate. Visit hungerandhealth.org to learn how you can make a difference today. Together, we can end hunger.
I think that video really puts into perspective just how important it is for food banks and food pantries to provide the most nutritious food possible so that we can give our community members the best chance at reaching their fullest potential. So that's some background of why we feel this work is so important and exactly why Gleaners implemented a nutrition policy. Let's relate this back to the neighbors that we serve as well. So in local as well as national surveys of users of food pantries and food banks, it was found that the top preferred or highest ranked food items that neighbors would like to see in a food pantry include fresh eggs and milk, fresh fruits and vegetables, and fresh meat, poultry, and fish. When we compare that to the items that were the lowest ranked by neighbors or the things they would least like to see in a food pantry, these include things like sweet snacks, salty snacks, and sugar-sweetened beverages. So by implementing a nutrition policy, we're not only promoting health, but we're also meeting our neighbors' preferences and needs for quality, nutritious foods. Our neighbors are also coming from increasingly diverse backgrounds, and so it's very important for our food bank to meet different cultural needs and preferences when it comes to the types of foods we're providing. If we look at cultures represented in our local community, especially in Indianapolis, we can find that there are some commonalities, even though there is so much rich diversity in the countries of origin and backgrounds of the neighbors in our community. Gleaners worked with the Immigrant Welcome Center to gain a better understanding of the types of foods that different cultural groups typically prefer when it comes to preparing food at home. So some commonalities across multiple cultures in the Indianapolis area include preferences for fresh foods versus canned, processed, or packaged. This includes a variety of fresh fruits and vegetables, so maybe beyond those typical types of produce items that we might see most often, like potatoes, onions, carrots, and apples, but increasing the variety offered to our community can help meet more preferences and needs. Rice and beans are very common staples throughout the world, and typically white rice and dried beans are preferred to brown rice and canned beans. So we want to keep that in mind when we're procuring these types of foods. Herbs and spices are also crucial to providing those traditional flavors of different cultural dishes for celebrations or family memories. So providing those types of cooking staples and cooking oils as well can be a really great comfort and provision to neighbors from different cultures. And lastly, a variety of meat and seafood is highly preferred by most cultures. There are some considerations for religious needs, especially when it comes to pork and other needs related to protein, such as vegetarianism. But for the most part, meat and seafood are highly desired by many different cultures. Now, when it comes to nutritious, defining this term can be pretty tricky. If you ask a room full of 100 people how they would define healthy food, you'll probably get 100 different answers. So this is where our nutrition policy puts into common language a definition of the term nutritious. So we're all on the same page and we can use some very simple guidelines to steer our food decisions. So when we talk about healthy or nutritious within our nutrition policy, We are talking about foods that are low in 3 key nutrients that have been linked to chronic disease risk when consumed in high amounts. These nutrients are saturated fat, sodium, and added sugars. You can find all of these nutrients listed on any nutrition facts label on a food package. And again, these are the top ranked items because of their connection to chronic disease risk. Foods that are high in these 3 nutrients tend to be highly processed and offer very little other nutritional value. So we use a system called SWAP, which stands for Supporting Wellness at Pantries, to rank foods based on their content of these 3 nutrients and classify that food as either a green or a choose often food, yellow or choose sometimes, or red, which means choose rarely. We don't want to totally ban foods because we know every food has a place in our celebrations and in our favorite memories with families. So this is simply a stoplight guided system that can help us as well as our neighbors to make healthier choices most of the time. We also want to think about variety when it comes to nutrition. So we use the My Plate Guide to make sure that we're providing foods from all 5 key food groups, including fruits, vegetables, grains, protein, and dairy. And then we also want to make sure, as I've mentioned, that we're meeting a variety of dietary, cultural, and/or religious needs and preferences so that we can meet the nutritional needs of our entire community. So you might be wondering, how did we get here? I know we didn't just immediately start adopting all of these guidelines and policies, and that's very true. We've come a long way in the past 10 or so years. So here's a quick look at where we've come and where we're going. Back in 2012, Feeding America adopted the Foods to Encourage, or F2E guidelines, as sort of a standard for generically ranking foods based on how likely they were to contribute to a healthy diet. We have used this system at Gleaners for the past 10 years. And in early 2019, we actually set a goal in our strategic plan to reach 80% of the foods we distribute being classified as foods to encourage by 2023. And I can say with confidence that we have reached and actually surpassed this goal, which is wonderful. However, this Foods to Encourage system is very broad and it doesn't give a specific look at how well foods actually promote health. And so this is where the Supporting Wellness at Pantries, or the SWAP system, really comes into play to give us a better idea of the actual nutritional quality of the foods we're distributing. We adopted this system at our on-site food pantry in late 2019, and then we started piloting it in our full inventory in 2020 into 2021. In 2020, also some national guidelines were released, including the Dietary Guidelines for Americans, which are updated every 5 years, as well as the Healthy Eating Research Nutrition Guidelines for the Charitable Food System, which I mentioned at the beginning of this presentation. It was during this year that we also piloted the updated SWAP guidelines with some other food banks to see how they might work in actual practice. This led us to ranking our inventory in 2021, starting with purchased and TFAP products. We formed a nutrition policy work group within our organization, and in this year we also received a grant from PHA, or the Partnership for Healthier America, to gain access to the WellScan app, which makes it very easy to rank food nutritionally as red, yellow, or green, just by scanning the barcode on products. Our nutrition policy work group, as well as some external reviewers, formulated a policy, and that was approved by our board of directors in February of 2022, and it immediately took effect. From there, we created an internal nutrition policy committee who is responsible for implementing and tracking our progress when it comes to the nutrition policy. So what exactly is in our policy? What does it say? So there are 6 key sections of our policy, and I'll just briefly discuss what those contain. The first section is just a brief statement of purpose, so what this policy is all about, which is what I've been explaining to you in this presentation. The next section goes through the rationale behind this policy, as well as some of the benefits, which I've also shared with you. Next, we talk about the types of food inventory sources that are covered underneath this policy. For Gleaners, we wanted to include all of our sourcing, including purchased, donated, government commodity food, as well as food that we purchase or receive from the Fresh Connect Central Cooperative. Next, we highlight the types of foods that we want to increase. These include all of those preferred foods by our neighbors, as well as those that are culturally responsive to the needs of community groups that we serve. Especially, we want to prioritize and increase foods that are ranked green or choose often, and yellow or choose sometimes, to really promote the health and well-being of our neighbors. Next, we talk about foods to prioritize and to deprioritize. Our internal working group decided to prioritize fresh fruits and vegetables as well as frozen fruits and vegetables because we know that these are in high demand and they are highly nutritious. We also wanted to prioritize healthy protein as well as dairy options because these are highly preferred by the neighbors that we serve. The types of foods that we will deprioritize does not mean that we will never bring them into our inventory, but it just means that we will contribute fewer resources towards bringing those foods in. And those include things like sweet and salty snacks, desserts, and sugar-sweetened beverages, including sodas. And the final element of this policy is an implementation and review plan, which is what the Nutrition Policy Committee will be implementing to really put this policy into action. I wanted to share just how important everyone's role is in formulating and putting into action a nutrition policy. This can't just be done by one individual or one department within a food bank or a food pantry, but it really requires everyone from upstream partners to the neighbors that we're serving to be on board for this process to be successful. So when we're looking at changing the types of foods being offered in food bank inventory, this can influence our upstream partners such as manufacturers, retailers, funders, and government programs to influence the types of foods that we receive from these partners. What we have to offer as a food bank impacts what choices are available to pantry directors, which in turn impacts what they have available in their pantry inventory, what clients are able to choose from at their pantry, and ultimately the diet and health of the neighbors served by that pantry. So you can see if one part of the system is not functioning fully, it can really impact the success of all of the other pieces in this process. So we need everyone from communications and human relations in staffing to agency partners, volunteers, government partners, healthcare partners, and the neighbors that we serve to be part of this process. So your role is very important and we can't do this without you. If you have any questions about Gleaners Nutrition Policy or about creating your own nutrition policy, you are more than welcome to reach out to me. My email is provided on this slide, and you can also visit our Nutrition Hub website at gleanersnutritionhub.org for more information and nutrition resources. Thank you so much, and I wish you the very best in promoting health and wellness in your community.